Okay, so we're going to run through a very quick TMJ screen. Basically, you're going to feel right in front of the ears, the tragus of the ear, underneath the temporal bone. You want to feel the lateral pole of both condyles. Have the person open and close. Open and close for me, please. And you're going to feel that space that opens up behind your fingers. That's going to give you an indication of how far the condyle is translating. Look for any S-curves or deflection. So if there's a deflection, that means there's not going to be much of a space happening on that same side. You'll be able to pick that up. Also feel if the lateral condyle, the poles of the lateral condyle stick in or out. Okay, so we're looking to see three-dimensionally what's going on. Measure how much motion is happening and then where the S-curve or the deflection is going towards. Once we're in that position, we can feel the temporomandibular joint, and we're going to start with the neck of the condyle, going front and back for the inferior synovial tissue. Then we're going to feel for the eminence, and then we're going to feel the fossa behind the condyle for the superior joint. If there's any pain at the neck, front, back, or on the top, eminence and fossa, there's some TMJ swelling. Another thing you can look for is a loss of the skin folds next to the ear. That is an indication of swelling as well. That means there's probably a TMJ or TMD disorder, an actual temporomandibular joint disorder going on. That's going to be further testing. Right now we're just looking for movement. If this is clear and no pain and the jaw is not tracking properly, that's something very treatable. In the same position, we're going to feel the superficial masseter, deep masseter, temporalis, front, middle, posterior. And then we're going to also hook along, find the transverse processes of C1, dig in a little bit, find the posterior digastric, feel along to the hyoid, anterior digastric, look for pain at any of those points, look for any sort of ear symptom reproduction when we're in this area behind the mandible. Very commonly people get very, very hot or painful or sensitive to touch to the gonial angle of the jawbone, so be careful when you're poking around there. Usually the tension is on the front of the neck. Okay, so that is our very quick jaw screen. The other things we're going to be looking for are in the mouth. So we're going to look and see what the person's bite is, if there's any lineal alba or scalloping on the inside of the cheeks. And for Jono, yes, he definitely has. He has ridges all the way in there, and his tongue has depressions. So it tells us that he's a clencher, but he's doing it severely. Okay, so that is a sign of clenching. And then we're going to also look at the bite. What type of bite are we dealing with? Is it off a little bit, overbite, overjet? What is happening with that? We're just going to be taking that information in, and that's going to help us with some very quick treatment. Finally, we're going to grab the temporal bones, and we can see if we rotate, put pressure up and down, pull up, push down, does that cause any pain? Does one side feel different than the other? And then in that same position, we have the person open and close to see, does that change anything as well? If that does improve their bite, we know that there's a cranial base component as well that has a treatment attached to it.